right, so our first session today is all about the medical office and medical administration. Our first speaker is Christopher Clarke, and he is the administrator for Dermatology Consultants of Sacramento. And then we have Megan Sharpe, the Chief Operating Officer for Jivome. Type your questions into the chat, like I said, throughout, and we'll also take a few minutes at the end for Q&A. And Christopher will be leading us through an activity as well. All right, so Christopher, I believe you are actually up first. Please take it away.
All right, well, thank you for having me. It's great to talk to you guys. So for medical administration, medical management, unlike physicians or physician assistants or nurses, we can come from several different backgrounds. Doctors go to med school, nurses go to nursing school, etc. But administrators and office managers can come from several different arenas. A lot of times you'll see managers coming from finance or the billing office. Sometimes they will come from HR. A lot of times they'll come from either the front desk or the clinic where they worked as medical assistant. And I actually came from a different background where I came from IT. So my IT background started when I was knee-high to a grasshopper and playing with computers when I was in the 3rd grade. And at a very young age, I knew that I wanted to serve. So the day after I turned 15, I actually enlisted in the Army. I had my dad sign for me. So I spent my last couple of years of high school just waiting to go to basic training. And after 7 years in the Army, when I got out, I continued my focus in IT. I worked for a manufacturing company where I was the IT manager, and this was in Eugene, Oregon. And when the organization moved from Eugene to Georgia, I decided I didn't want to move to Georgia. So then I went to looking for another position, but I wanted to work in an organization where it was, again, more of a service industry and not just about the bottom line. So I found a position working for a multi-practice specialty in their IT department. And I worked there for a few years before I went to an orthopedic practice where I was the IT manager. The president of the board happened to be the commanding general for the Army hospital during Desert Storm. And since I was in Desert Storm, we had that background and we'd share war stories and all that stuff. And so when the administrator at the time resigned, he came to me and just said, "You're the new administrator." So that's really how I kind of fell into medical office management. So after I was assigned that role, I went back to school. I got my MBA in healthcare administration, and then I also got a second master's in organizational industrial psychology. And since then, I've done ortho, I've done neuro, and then about 8 years ago, I came down to Sacramento to specifically for this role at Dermatology. So coming from IT, I had a lot of different skills that I was able to bring aside from just the leadership stuff and the stuff that I learned during my master's program. So like I said, a medical office manager can come from any arena. So you really just pick your passion, you pick what you're good at, what you enjoy doing, and really any of those can lead you into medical office management, because what we do on a daily basis incorporates all of those different fields. We have to deal with the finance stuff, whether it's payroll, accounts payable, accounts receivable. We deal with the front desk, check-in, any kind of patient issues, helping out in clinic. Obviously, I do a lot of the IT stuff. And then the biggest hurdle in any industry, and especially in healthcare, is the HR side of things. Dealing with staff, any staff issues you have, hiring, firing, making sure you get the right people in the right positions, and then of course, dealing with any issues that staff may have among each other. So on a daily basis, there's a lot of tasks that I go through when I get in at 7:30 in the morning. I'll check my email. I look at the schedule for today to see, are there going to be any bottlenecks? Are we going to have any issues with any patients? Is there any procedures that are going to go over long that we might need to shift staff around for? I also take a look at the bank to see what monies have come in, if we need to focus anything in that direction. Any patient issues that come up, if patients are unhappy with their visit, or if they have additional billing questions or insurance questions. And then also I review the schedules throughout the day to see if anything's opened up, if we need to focus on the wait list, and also what the next day is going to bring and what the next week is going to bring. I usually look 2 to 3 weeks out to see if we need to shift anything around, if anything was scheduled incorrectly that needs to be corrected. And then, of course, you always have doctors coming to you and saying, oh, hey, I'm going to take tomorrow off, so we need to move around all my patients. So we have to deal with those issues as well. When we're looking at the schedules coming up, also it's making sure we have adequate staff, and if we need somebody to help out in clinic as opposed to working on the inbox, shifting people around with that. A lot of what I do and what my management style is, I call management by walking around. And I learned a lot of it from being in IT, because I found if you're walking around and talking to the end users, the people working on the systems, you can identify issues that come up before they become real problems. If somebody says, oh, I keep having this pop-up come up and I just keep hitting okay, it might be, malware that they didn't recognize. So walking around talking to them, it helps to identify those problems. And it's served me well in management also. I can walk around and see if staff have any issues. I can see where the bottlenecks are at, if I need to shift stuff around. And it also just keeps my presence throughout the clinic. So staff know that I have their back if anything comes up, if there's any questions, if the doctor needs to grab me for something, I'm always walking around. So management by walking around. Any questions so far? Did your time in the military help pay for your education? To a certain extent, yes. When I went into the military, I really just kind of jumped right into it. I didn't bargain a whole lot to get a whole lot out of the GI Bill or additional money for college. At that point in time, I figured I was going to be in the Army for life. That wasn't the case, but it did, the GI Bill did help me get some education while I was in, and helped me pay for some of my associate's degree. Back then, it was just called computer networking, and not all the different types of computer stuff there is now. So the patient load and how many staff members, typically we see I have 4 providers, and each provider will see up to 40 patients in a day. We never have more than 3 providers in the office. So on average, we'll probably see between 70 to 80 or 90 patients on any given day. On Thursdays, we have all 3 of the doctors in, and each one sees, like I said, about 40. Tomorrow, we have 106 patients. Last Thursday, we had 108, and the Thursday before that, we had 110. And so that's been kind of average the way it's been going. I currently have 14 staff that work for me, and with 4 providers, that's actually a little bit understaffed, except that we make sure that all the staff are cross-trained. I have individuals that work in clinic that can also work up front. All of my scribes can also double as medical assistants. So I have 3 individuals that work at the front desk, 2 people in billing. Each one of the providers has a scribe, and then we have 4 MAs and 1 part-time medical assistant that does our prior authorizations. Any other questions? It's a lot of information that I just spewed out. All right. Megan.
Lindsay, did you want to take a quick break before I jump in, or do you want me to go ahead and just get started?
No, go ahead and get started.
All
And well,
right.
guys, I know you have more questions, so please put them in the chat. It is incredibly complicated. Christopher made it sound so easy to just run a medical practice. It's not, newsflash, right? So I know you have to have more questions, so please put them in the chat and we'll make sure to take some time at the end. Oh, we got some more. Megan, if you don't mind waiting a second, what do you look for when you're hiring people, Christopher?
So that really depends on what position I'm hiring for. And the activity that we're going to do at the end, it's one of the things that I utilize to help identify which role a individual is going to serve best in. So it depends on what I'm hiring for. Of course, in healthcare, you're always going to look for someone who has that desire and passion to help people. One of the main focuses that I have in my main drive and why I get up in the morning is that I know that people don't enjoy coming to the doctor. Nobody likes going to see the doctor for whatever reason. So they're coming to us in a position of extreme vulnerability where they're either putting their lives in our hands or their children's or loved ones' lives in our hands. So it's up to us to make sure that we do everything that we can to make their day better in any way that we can do that. And so that's one of the things that I look for when I'm hiring somebody is they need to have that kind of focus and that kind of vision as well.
Did you feel like you needed to know quite a bit about the practice of dermatology before you stepped into this role?
Not necessarily, not dermatology specifically. You have to know how to run a practice, all the different ins and outs and how everything fits together. I've worked in several different specialties from dermatology to orthopedics to neurosurgery, and it all runs the same. Everything has to work the same. It's just the different nuances for the specialty that are different.
Okay. Thank you, Christopher.
Mm-hmm.
All right, Megan, you are up.
So I wanted to talk to you guys just a little bit about why healthcare. My background is very different than Christopher's. And so I'm here to share a little bit about that with you and hope that it stirs some motivation for you. I always start off, I'm a little corny. I like to start off with quotes because sometimes they resonate well with people. I am always drawn to them. And this one really stands out to me. So something to remember, a true passion that burns within your soul is one that can never be put out. So I want you to remember that. I know you guys are in high school and you have so much time ahead of you, so many things that are going to change between now and the time your career begins. But honestly, this is follow your passion. And if it burns deep down in, nothing can stop you no matter what you encounter in life. So like Christopher said, what motivates you? I think that no matter what position you are in the healthcare field, go with what motivates you, what drives you. There are over 250 healthcare professions out there, everything from your physicians to all of the clinicians, your ancillary providers, but there's so much more to it than just that. You have your support staff, your MAs, your receptionists, all of those play into a team. As an athlete growing up, again, I believe very much so in teamwork. There is not a single individual in an office that will make or break you. Sometimes you have to pick up pieces where things are dropped, but at the end of the day, it is about a team and working as a team. So I want you to know that as you start your career, if you're just the receptionist, you are the first face that those people see when they walk in. And that in itself is immediately going to build trust with your patients that come in through that door. It will immediately set the tone for the rest of the office. And that is just as important as the person providing care to that individual. So I never want you to think, no matter what position you have, that you are just that. And yes, being a physician and a nurse is fun and it's very exciting. And for some, that's what drives them. That's what motivates them. That is what their passion is. And that is what they're set out for. That's amazing, but that's not for everybody. And I don't want you to think, like I said, that it's any less. So again, I ask, what drives you? Be happy. you're not stuck with the first healthcare job you choose. And I'm going to talk to you a little bit about this, but you can always go back for more education and you can always move up in the healthcare field. There are so many places for you, regardless of if it's on the job training or if it is actual education where you have to go back to a vocational school, or whether you're going back to graduate school or whatever that looks like, there is always room to move up. So why am I here? Well, I don't know. Lindsay called me one day and was like, hey, I really want you to give this presentation. And I said, okay, I'll do whatever you want. But I'm not the norm. And I think that that's why she asked me to come here. So unlike most people in healthcare, especially in an administrator role, I don't have a graduate degree. I worked my way up through perseverance. I started out from a really young age, and I knew that I always wanted to be in healthcare. I was always fascinated by science. And from the time that I was about 5 years old, I would sit in front of the TV and I would watch knee replacements and hip replacements and skin grafts while I ate meals. And my sister thought I was insane. So am I twisted? Maybe, I might be. But I've always just been so fascinated by science and the fact that it can literally change a person's life. I mean, from the brain to the skin and everything in between, it is an incredible industry. And I've always wanted to learn all aspects of that. And you'll kind of see that in how I went about my career. So my goal was to be a plastic surgeon. I have always loved that field. And it turned out while I was very early into my college years that life got in the way. I had some family things come up and I quit. It's something that always weighed very heavily on me when I would apply for positions. I always felt like because I didn't have that degree that I was less than, especially when you're working with individuals that have what seem like a million years of college under their belt. When you're working with physicians and they go to school for so many years, they go through their graduate training in medical school and their residency, some go to fellowships. I always felt that I was less than because I didn't have that degree. But what I quickly realized was that I had a personality and I was important and I had something to offer. And so starting out when I was in high school, again, kind of backing up just a little bit, I knew that I had goals, and the way that I was going to achieve them was by starting my career in healthcare early. So I went to an ROP class, which got me my CNA, which is Certified Nursing Assistant. And I did that while I was in high school. I don't know now if they count it the same way as they did when I was in school, but my CNA course through my ROP, it was a 6-month program. It counted towards credits for high school and for college. So I was actually able to graduate a year early from high school. And I started out with, I believe it counted toward 9 units of college because I was putting it toward my healthcare career and education. And so, yes.
Where did you take that course?
It was through
college?
49er ROP in Auburn. I'm not sure if they are still there, but ROP programs do absolutely still exist. As a minor, I did not even pay for that course. I simply enrolled in it and was accepted into it. I think once you become the age, once you hit 18, it's there is a fee, but it's very inexpensive compared to like vocational school. And so I chose that route, and it gave me a degree, a certification, if you will, not a degree, but a certification under my belt to be able to put something on my resume for when I started going out. I moved into a medical assisting role from there, and give you a little tidbit of information. Yes, there are CMAs, which is a certified medical assistant, but in the state of California, you do not have to be a CMA in order to work as a medical assistant. So I went to work for a doctor who was willing to train me on the job and provide me with all of my training hours necessary. And I became a medical assistant to the point that I could do intramuscular injections. I shadowed her. I soaked everything up that I possibly could. And I basically just acted as a sponge. And I forgot to put on there that I moved up into a surgical tech, similar. I operated under a physician who was willing to train me, give me on-the-job training, and it didn't require any more school. I just happened to get in with a physician who really, truly cared about helping younger professionals move up in their career, and it worked well for me. I utilized my experience and my personality to become a trainer. And so I was deployed into other clinics to go train their staff. And I had the opportunity to travel out of state a little bit and go work with other doctors, which was really fun for me. I'm a very social person, and training people is a passion of mine. And so I filled that role, and I did it for quite a while. Then I became a practice manager. I was kind of thrown into that role where our practice manager was let go, and they said, here, you can figure it out. So again, no professional training, no schooling. I just got thrown into it and learned to be very resourceful, and took all of the webinars that I possibly could, and I studied outside of hours. But again, it took drive. It is a very different career path than what Christopher had, because I was kind of thrown to the wolves in a sense, and sometimes felt like I was drowning because I had no idea what I was doing. But you know what? I figured it out, and I have full confidence that you guys can do the same. From there, I actually went over to SSVMS, Sierra Sacramento Valley Medical Society, which is where Lindsay works currently. And I became the director of physician relations. In that role, I primarily worked with independent and solo small practitioners to go into their practices, kind of evaluate things, teach them best practices, and really work with them and their staff to help them improve their flow and efficiency of their practice. It was something that I really enjoyed doing. Again, it goes back to me loving to train people. I am not the individual like Christopher that enjoys managing people. I like training them. So practice management was something I did in the past. It's not something that I necessarily want to do now. And that brings me to my current position. So while I was at SSVMS, I was working very closely with some board certified dermatologists who actually recruited me to not only open up their new cosmetic and integrative wellness center, but also get their online health and wellness platform up and running. And again, it was not something that was in necessarily my area of expertise. It's not something that I went to school for, but they saw my drive and my passion, and they recruited me and said, you know what, I believe that she can do it. And so here I am today. Why do I do what I do? Well, I may not be the plastic surgeon that I dreamed of being. I still have ambitions and dreams that maybe one day, I don't know, I'm still young. Again, I can always go back to school and do that if I decide to do that. But right now, I find happiness every day in what I do. I'm able to use my entrepreneurial spirit regularly. Again, with a startup business, it's not for the faint of heart. I feel like I'm climbing an uphill battle many days. A lot of things are outside of my wheelhouse, but it's fun. It keeps me on my toes. I get to use my brain. I'm challenging myself. I'm growing not only as a professional, but as an individual as well. And that is something that drives me. And I also get to help change the way skin health and beauty are viewed. So while I am in the cosmetic field and industry, we also focus on gut health, and we focus on self-awareness and mindfulness, and we teach meditation and stress and anxiety management, because those things all play a role in your overall health and beauty. So a lot of people view beauty from the outside, but you're really truly only as beautiful as you really feel on the inside, or at least that's my opinion. And so it's something that I get to train our staff on. I get to educate them on ways that we can help individuals in their everyday lives, not just coming in for a cosmetic service and making them look beautiful at that time, because skin beauty only goes so far, right? So really working on themselves and how to improve their daily lives. And I get to share my passion for this industry with others. I never in a million years thought that I would be sitting here talking to a group of high schoolers and trying to motivate them to go into healthcare, but here I am. I absolutely love it, and I know that you will too. So what speaks to you? Your dreams and aspirations may be very different than mine, but again, there are so many things you can do with it. So are you an adrenaline junkie? Maybe the emergency department is for you. I am an adrenaline junkie in a different way, but I don't necessarily want people's lives being in my hand all day, every day, or having to think on my toes. But that might be for you. Are you reassuring, tenderhearted, and goofy? Peds it is. I mean, I have never met a pediatrician that I have not absolutely fallen in love with their personality. They are just so carefree and charismatic, and we need those individuals to work with our little ones that are terrified when they go in. Do you enjoy going nonstop and the chaos of all the things around you? Then maybe nursing is a great fit for you. Do you enjoy blood? Well, you can draw all the blood you want with phlebotomy. Again, that's not for me. Do you enjoy being in charge? Maybe healthcare management is right up your alley. Are you tech savvy like Christopher? Maybe healthcare technology is right for you. So some reminders that I want you guys to take away from today. You have many options, and all of them are equally as important as the next. You can always move up. So don't ever feel like if life gets in the way and you have to hit the pause button for a minute, that's it. That's the end of your career, because really the sky is the limit and you truly can do whatever you want to do. I know that sounds so cliche, but it's true. And you can change lives no matter your role. Again, from you being the first face that people see to you saving lives in the emergency department. Always, always follow your passion. And it's okay if that passion changes. Find your happiness wherever you are. So I have my contact information here. If you're not the individual that likes to ask questions in a group, that's okay. I am happy to field questions. My cell phone number is on here. I am happy to answer any questions about what career paths look like or what my role on a daily basis looks like. But write down my email address or my phone number, or reach out to Lindsay, and Lindsay, you can always pass that on to them as well.
Sam, can you throw that in the chat, please, so the kiddos can just copy and paste it? Thank you. All right. Do you guys have any questions for Megan? Like she said, I know many of you are more comfortable emailing the speakers directly.
And as Lindsay said in the chat window, yes, I still watch that stuff while eating.
I know you do. All right. So before we move on, because we went through this a little bit fast, I'm going to share with you, because I may not be in medical administration, but I certainly am in the medical field, even though that's not where I thought that I would end up. I'll share with you just a little bit about my background now. So when I graduated from high school, I thought I wanted to be a teacher, and then I thought I wanted to be a cop, and then I thought I wanted to own my own restaurant. And gosh, what else did I want to do? I wanted to do a lot of things. In fact, I have an associate's degree in criminal justice, but I took one ride in a cop car as a ride along and decided I was not going to do that. So then I decided to go ahead and just get a business degree, because a business degree can fit anywhere you want it to fit. So I did receive my bachelor's from the University of Texas in San Antonio in marketing. And I don't know why I chose marketing, because I can't stand sales, but it sounded really good at the time. So, you know, my first job right out of college, I ended up working for a marketing firm that designed football related products. I may like football just a little bit much. And then I decided, you know, my passion is elsewhere. I think I'd rather go into nonprofit work. So that's technically still what I do, is nonprofit work. It just happens to be in healthcare now. So I moved to California and started working at an organization called Ag Against Hunger. and it is a food bank that supplies produce to food banks all across California. And like Megan, I worked my way up from being their marketing manager to their executive director. And I was there for 5 years, serving the community and feeling really good about what I did. And then we decided we wanted to move to Sacramento. So I applied to be the executive director for another nonprofit, but it was a nonprofit association, the Placer Nevada County Medical Society. That's our sister medical society to where I'm at now. So basically what I'm saying is I had no business working in healthcare when I started working for the Placer Nevada Medical Society, but I figured it out. And now I've been with the Sierra Sacramento Valley Medical Society. I've also been promoted up through the company, now the Vice President of Strategic Operations. And I have a background in healthcare now. I've been in it for 7 years. So the point is that you can study whatever you want. And I think you guys have heard a lot of these themes over and over and over again, right? Some of you that are on camera, thank you. You've heard these themes over and over and over again. You don't necessarily have to study biology or a science of some sort. You don't necessarily even need a bachelor's degree, depending on what you want to do. You can get one. You can get a master's degree. Those are all wonderful degrees. Getting your doctorate is wonderful as well. But you can work your way up into whatever position you want to do. And you can do that through drive and perseverance. And you just really have to take chances. And I do that a lot. I take a lot of chances. Megan knows that about me very well. That's one of my favorite things to do, is to take chances. In fact, this program was a chance. We got a grant to put this on for all of you guys back in April, and we put it together in less than 2 months. That's taking a big chance, and I'm so glad to have all of you here. So, you know, at the Sierra Sacramento Valley Medical Society, we have 11 staff members. I think 6 of them are my direct reports. We do a lot of nonprofit work in the community. Obviously, this is one of our programs. We have another program where we do free surgeries for the uninsured. You heard Adriana come and speak to you all. Marley, she also works for us. She spoke with you on Monday. She runs our Sacramento County Opioid Coalition. So we do a lot of work in helping people that are addicted to certain substances. We have a program for physicians to receive free psychological care. That's another cool program that we do. We have our Museum of Medical History. Remember, if you've attended all of these sessions, we have 3 slots this summer for you to intern with the museum. There's a lot of cool projects coming up. So hopefully I'll see some of you apply to that position. We do have a scholarship, I mentioned this as well, for students who are in medical school that attended a high school here in the Sacramento region. So any of you out there, if you're interested in attending medical school, there is a scholarship for you when you start attending. So, you know, again, you don't have to have, there is no set career path to get to where you want to be. I'm truly passionate about what I want to do now. I know that Megan's passionate. I know that Christopher's passionate, and certainly none of us took the straight, you know, road to get there. And just because you decide to do something, you know, now or when you're 18, who knows what you'll be doing in 20 years. But I bet it will be something absolutely amazing, because you guys are taking your time out of your summer to come and sit here and listen to all these people talk about what makes them passionate about healthcare. So I have no doubt you guys are going to be doing some amazing things. And hopefully it'll be some physicians in the crowd. Yes, Megan.
One thing I want to add to what Lindsay was talking about, all of the great things that SSVMS does. One thing to not rule out, again, not my area of interest, but if you have an interest in politics, policy in healthcare is something that I think is so overlooked, and we always need advocates. And so that is your way, even if you decide, especially if you decide to become a physician, policy is what dictates how you're going to practice, right? So don't overlook something like that. Again, even if being a physician isn't necessarily for you, and maybe you want to be a lobbyist or something for healthcare, that's still in the healthcare field. Again, so important. Not my area of interest. but no,
okay. Janice and I already talked to them earlier this week about
Perfect.
healthcare policy and
Love
advocacy.
it.
So
Yes.
I don't think anybody raised their hand to be a lobbyist, but that's okay. We can still be advocates, right, guys? And
Yes.
you know, you don't even have to be advocates in healthcare if that's what you end up not choosing later on. Just be an advocate for whatever career you decide to go with.
Absolutely.
So, all right. Well, thank you to both of our speakers. I think we have a really fun activity now that Christopher wanted to lead you all through. So I believe, Sam, are you on? What did they receive? Did they receive anything in their packets on this activity?
Yes, they should have received the form. It should be dated with today's date, and it's the form. Christopher will share his screen, and you'll see it. It's a grid that we're going to rate.
Okay. All right. Go ahead and get that all out, guys. And Christopher, please share your screen. Take it away.
All right. So as I said before, this is one of the tools that I use when I'm trying to find the right position for people to be in. It's a pretty simple personality test. It's not nearly as complex or intuitive or time consuming as like a Myers-Briggs or something like that, but it can give you a really good idea of where your personality fits in. And it's also fun to give to your family and friends to see where they fit into. And it can help out a lot because it identifies the basis of what their personality is. It can also help in communicating with them so you know the way to talk to individuals, how they want information presented, how best to communicate with them. So let me go ahead and share my screen. And that's one of the things that I also wanted to reiterate is for like what Megan said with teamwork and stuff. It's very, very important. And it's not just the team that you're going to have at your office, but it's also the network that you're going to form outside of the office. Megan and I met with when she was working at SSVMS, and we served on the board for the Sacramento MGMA, and I think we did amazing things there. So it's a lot of networking as well. All right, so this is called the PACE palette test. And like I said, it's pretty easy to go through. It doesn't take a whole lot of time. So the form that you guys were given looks like this. And there's 5 different rows of groupings of words. So when you're going through and taking the test, you go row by row and you pick the group of words that you resonate the most with. And that's going to get a score of 4. And then the next one's going to get 3, then 2, then 1. And then once you're done with all of each one of those rows, you add it up at the bottom, and that's going to give you your color palette that you most resonate with as your personality. So has everybody finished that? Ready to go? So I can go into what each color means. Lindsay running behind.
I'm
I'd
running
give them
behind.
some
This is the
time.
first time I actually looked at it, so I'm doing it too. I know,
Yeah,
I know.
They won't have it rated yet, so I would give
Okay.
them some time.
Yeah, no worries. So I like to do this, like I said, with staff and also with the providers. It can give some pretty interesting insight into the individuals that you're working with. And it's helped out a lot when I've come across an individual who I absolutely is a great worker, but may not be achieving their highest performance in the position that they're in. So doing this PACE test can kind of identify what role they would serve best in.
Yeah, and I'll just kind of add to that a little bit. So when I'm doing my hiring, I know one of you had asked, what do you look for in an individual when you're hiring? And honestly, I look for drive. I think maybe my background skews my vision a little bit in the sense that I don't immediately look for a degree, but I look for a drive and motivation in an individual. And I hire that individual based on their personality, and then we'll find the position for them that I think they will be best suited for. I'm currently going through the interview process right now, and people are like, well, what position are you interviewing for? The individuals that I interview might not be a good fit for that position, but that doesn't mean that I'm not going to hire them if I really enjoy them. So just keep that in mind, moving forward.
Does anybody need more time? Nope. Looks like some of them are still going through it. Give it another minute.
No worries.
Please. What if you have different colors for every row?
So it's not uncommon to have colors that come up as a tie.
Okay.
Mostly you'll come up with two main colors that you kind of resonate with, and the other ones will obviously be less. But that's not always the case. It's sometimes you'll be very, very much one color and really not another color.
Okay.
And that's one of the things that with this test, you can change your colors and how you resonate with age and experience and whatnot. What you enjoy and how you are now may be completely different than how you are 10 years from now or after you have kids or whatever. Things can change in your life that can change your focus and change your drive. A lot of it will still resonate with you, but it may change how you view the world. So, and there are sometimes that this test, if you take it thinking about how you are at work or at school, and then you take it again when you're at home and how you act at home with your family, there can be some subtle differences as well. It doesn't always happen a lot, but that can happen.
All right, I think we can probably go ahead and go into the analysis of them. By the way, I'm red and green, so put your colors in the chat if you feel like sharing.
So red and green, actually, with what you talked about and how you described where you got to where you are now, that is not surprising at all. I would say, Megan, you are probably a lot like me, but you're probably more yellow-green, and I'm very much green-yellow. I would say you probably have a lot of blue in you as well. So let's go into the definitions of the colors and what each one of them mean when we're looking at this. So when you think about red for an individual is someone who really enjoys adventure. So if you look at the first part right underneath the headline, that will kind of describe what a red person comes out to. And when looking at individuals that resonate with the red color, they're very much creative. So those type of individuals would be good at marketing, not necessarily sales, but marketing, putting together an idea. Let's try this. So that's how a red individual will resonate. So when you're talking to a red individual, think about how they are receiving your message. And if you're coming at them with very much, when you do this and this and this step by step, their eyes are going to gloss over, and that's not going to work for them. So knowing your audience is very important. Knowing that when you're going to go talk to that individual and how you want to present that information or get them on board with something or ask them to do something, really morphing your message to a sense that they're going to understand it and take it on is really important. And that's the same with any of the different colors that we look at. But that's what a red individual is. Like I said, a lot of times, the individual like this, they're very good at marketing. So yellow individuals, a lot of individuals that work in billing and finance will be yellow. There's a set of rules that we follow. This is how we do things step by step. We have to do this first, then this, then this. If you talk to any billing manager or somebody who works as a coder or whatever, very, very yellow. They know how they want things done, how they're supposed to be done. They follow the rules. So when you're going to talk to those individuals, keep that in mind that, okay, this is the project that we're doing. This is what we're going to do first. And then we're going to do this, and not necessarily focus on the grandiose, and we're going to have this font, and this is the color of the text, or even this is what our ultimate goal is going to be. this is how we're going to get there. That's what a yellow individual very much focuses on. And again, finance and billing. Blue, this is your front desk people. Blue individuals are very, very people oriented. They love taking care of people. They love helping people out. If you come to them with, these are the steps we have to take, they'll shy away because they want that, those soft skills, the touchy-feely, like, this is how we're going to take care of people, and this is what we're going to do. And, wouldn't it be great if we did this? These are the ones that are going to stop on the side of the road to pick up that kitten that they see and take them home. Very, very touchy-feely and very personable. So very much front desk.
All right, there's a little bit of blue in me right there, Christopher. I used to get in trouble for bringing stray animals home all the time.
Yeah. Surprisingly, there's obviously providers will have a lot of blue, but depending on the specialty, the amount of blue that a provider will have often is going to change. When you're looking at peds, yeah, very, very blue. If you're looking at a neurosurgeon, not a whole lot. There is steps you have to take, and if you like me at the end, great, but I'm going to fix you first. So the last color that we're going to look at is green. This is what you will see a lot of office managers and administrators, the color that they resonate with. They are big picture oriented. Where do we need to be? Yes, it's important how we get there, but what is the ultimate goal? What are we ultimately going to be at? And if you come at that individual and again, you give them the soft side, or this is what we're going to do, and not really focus on this is where we want to be, they're going to not listen as attentively as you may want them to. So again, it's very important to keep in mind who you're talking to, know your audience, know the message that you want to get across, and formulate that message in a way that that individual is going to accept and understand and follow along with more readily. So these are yours to keep. And like I said, it is kind of fun to give those to your friends and family to see how they come out. I've done it with my spouse. I've, of course, done it with all my staff. I've done it with my daughter just to see where they're at. I think my daughter's probably different now than she was when I gave it to her when she was, I think she was a sophomore. Now she's, off 24 working up in Washington. So she's completely different than she was back then. So any questions on the PACE palette?
So somebody's asking if it's pink. I think it's red is the color.
It's red.
Yeah, it's red. Well, that was interesting. I'm clearly in the right field. Megan, you're in the right field. I really wish I had taken that that quiz before I started college. It probably would have saved a lot of time jumping from idea to idea. But there's nothing wrong with that, guys. You should always try things out. I mean, even when you're older, there's nothing wrong with trying out new things and trying new careers. So if you guys have any other questions for Christopher and Megan, throw them in the chat now, or feel free to email them individually, or email Sam and she'll make sure it gets over to them. And guys, please help me thank Megan and Christopher. This was awesome. Really appreciate you guys coming and sharing your stories and what you do every day, because it is so important. Without you guys, we really wouldn't have practices or places